Welcome back, Keepers of the Flame. Oh, look at hi, baby. Yeah, Sophie. I was about to hit record, and I'm like, "You coming?" She's like, "Yes, ma'am." Okay, so here, I'll adjust a little. Oh. Okay, so just got off a little call, little chit chat. We attended a conversation, I guess you could say, between two doctors. One was German and the other one was from the US. And they were talking originally about the vaccinated versus the not vaccinated and how that's working and blah, 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 blah. They started picking up on hydrocells, otherwise known as synthetic cells. This is going to be a little bit of a doozy, going to be a little uncomfortable, but walk with me through this for just a moment. So, I don't want to get technical because even some of the jargon they were using, I'm like, guys, just stop with the superiority Nazi white coat complex and just talk real, okay? And because he was like, hey, could you please describe this for the community, because she works in a very specific field where it's specific. It's very, very specific. So a lot of things that she referenced were like, what the hell even is that? And it again, it's a Nazi white coat definition for something else entirely. So she was speaking in a logos that had a different language, but she refused to use it because superiority complexes come in large doses when you're dealing with Nazi white coat community members. And it's frustrating, it's aggravating, and you're like, if you know that, why are you doing what you're doing right now? Like, if you're aiming to help the general population, how the fuck is that going to get across? Right? It's Fae of the Souls. So, trying to sift through all her medical jargon and bullshit and, like, talking with my girlfriends, they're like, that's why a lot of us have a difficult time advocating for people and patients and whatnot, is because we really, really do have to get them to talk to the patient, even. Because when they find out they're talking to somebody who does know generalized medical terms, they begin to try to exert their authority and superiority. And then you're like, dial it back, Moses. We got somebody here that needs some help. Please, 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 if you are in any way, shape, or form involved in the medical community, keep that stuff in check. Because a lot of times when you're spouting that, the patient doesn't understand. The patient's not comprehending what you're saying. They don't know what you're doing to them. They don't know what's happening to them. They don't know what's wrong with them. And they have no concept of how it is you're going to exactly fix that. They just know they're getting a medication that they need to read the instructions on and follow them. Does that sound like a good way to live to you? No, that's a terrible fucking idea. You're giving all your bodily autonomy away to somebody who doesn't even speak your language or refuses to. Okay, so please, 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 please don't do that anymore. Right, Peso? Taste them around. Okay. So, I love it when she's like this. They're so sweet. Okay, so the basic general consensus was, as much as I can get it out, is so these synthetic cells, they call them hydrocells. I'm gonna try to get over that real quick because it's really annoying me. Okay, this is why so much harm has been done by that community, is because, like, even for me to have to, like, I was even grappling with it. I'm not a medical professional. I have not been medically trained. I know some Latin, okay, but they're starting to not use Latin. Hydrogels are not Latin. Okay, well, hydro is, gel is not. The accumulation of words has not been used before. Okay, sorry. I feel like I'm okay. So they're creating what looks like a perfect membrane, and they can identify the cell. Okay, so and they're too full of oxygen, so they almost have like a double membrane around them. And I sincerely apologize for those who are getting lost. But for those of you who are interested, I'm going to give you some of the intel. If I can get a copy to the link of the meeting, I don't know if they've sent it out yet or if they're going to send it out. It was a live meet where there was a group of us that were allowed to attend. I don't even know how many were there. They didn't have a group chat, nothing, because the main consensus was that these people could lose their fucking careers because of what they're trying to get out to the public. Okay. All right. So it's not like, oh Jesus, the world is ending. No, this is medical information that's new, that new-ish. It's probably been around for a while, but they're finally being able to come out and talk about it. Okay, so don't panic. Stop panicking. So synthetic cells are in the human body, and it started off with the vaccinated, and then it spread to the non-vaccinated because that's how shit works, unfortunately. And the people that are living with the vaccinated people, your cells begin to deteriorate faster because it's a respiratory thing. Okay, so I'm not going to explain the whole thing to you because parts of it I can't trace all the way either because I'm not a know-it-all. I don't. Okay. Repercussions. That's what we're dealing with right now. Repercussions. Okay. So, what the system is producing is like a bypass of the immune system. It's a bypass. Okay. And so, with all this synthetic crap happening in our system, kidneys aren't able to flush it out effectively, and kidney disease is skyrocketing. And I referenced this in my previous video. That's kidney disease is the actual epidemic right now. It has nothing to do with, and there's people also dying of heart conditions because of this. I'm sure that there'll be a whole plethora of other horrific things that will happen to the human bodies over time. And yes, I did say that if your partner got vaccinated and you did not, you're in a lot of fucking trouble health-wise. Okay, so you need to start thinking about that. Good news, good news, good news. Metholine blue, gonna help you. Gonna help you both. Okay, now there's other protocols that you can use. There's other things that you can look up online. It starts with an E, but it's a heavy protocol of like serious, I have to take at certain times a day. Okay, this is a little bit easier. Okay. And again, if you want to look that up, there are methods and medicines that you can take to negate this in the body. Okay, but it's very complicated. I think it's at least 3 different medications, and you have to take it every day for an extended period of time. Okay, so you can look into that. You can definitely look into that if you're not interested in methylene blue, but it is going to help you get some of these toxins out of your system. I am not a medical professional. I am not giving you advice. I am telling you this is what I heard today as entertainment on the interwebs, yada, yada, yada. I'm not even going to blow the whistle on who it was. Bing, bang, boom. Okay. So when we have this thing going on in our bodies, so rather than go, oh my God, my body. No. Body, I apologize. I did not know. I love you so much. We're going to get through this together, and I am going to do my human homework, and I'm going to do my research, and we're going to find the best way to deal with this ourselves. Okay? So don't panic. I've got your back. Okay? Talk to yourself as if you were your best friend. There's so many people that have that instinctual disassociating programmed in. There's something wrong with my body. And then you leave your body. And then you're like, wah. No, don't do that. It's okay. Skin is good. Eyes are good. Love is good. My body is healthy. Okay? So rather than shame and like whatever else, okay? Don't step into that. Step into, okay, okay, I see the problem and I've got a solution. Okay? You just need to look up the dosage and what's right for you. And it's micro dosing. It's not like all day, every day. It's just a micro dose. It's so easy. It's so easy. Okay? This is why I didn't tote the other one, because, like, holy bejesus, it was a lot. And it was super complicated. And I'm like, oh my God. So look up different ways and get on some methylene blue. Okay? Um, reishi. Reishi would be a good one to get on, and you can pair it with a few other mushrooms. Sorry, my cat is like, I'm just going to dance all over. Okay? So, and again, the spray on the food. So if you can get organic stuff, non-GMO, it's pumping a lot of problems into the body, causing difficulties with the kidneys and all that other good stuff. Okay? So, you know, all those people out there saying, oh, chemically this and chemically that, it's fine. It doesn't show up after the first can of soda, or, you know, the first vegetable doused in freaking GMOs and weed killer or pesticide repellent. It doesn't show up after that. It's years and decades after. Decades of repeated use. Okay, so, and you can reverse this. It's not like a, oh my God, it's reversible. It's just, and I understand we're going through a hard economic, lovely little right now, because humanity has just started figuring out it lost itself about a couple thousand years ago, and we're just trying to retrieve it. So just go easy. Go easy. Be so kind and gentle and compassionate. Be loving, be caring, especially to yourself. Okay? If you took the shot and, you know, you told other people they were going to die and rot in hell because they didn't take the shot, forgive yourself. Okay? Well, we're just going to have to do this together. Okay? So, this is the methylene blue is for both, vaxxed or unvaxxed. It doesn't matter. This will help you both. Okay? So, whatever it is. And yeah, if you're an unvaxxed person, vaccinated people are going to be bad for your health. So get on some methylene blue, please. That's the gist of it. Okay. And so you can look up synthetic cells. I don't think there's too much about it out there. It sounds pretty freaking new. But yeah. If I'm going to do this, I don't see why keeping it from people is a good idea. And you can be skeptical, you can be judgmental, you can tell me I'm full of shit. You don't have to do any of this. That I'm not a medical professional. I'm not giving medical advice. I'm just telling you I was privy to a conversation that raised some serious and significant alarm bells. And I want people to be happy and healthy, and whatever that looks like for you is what it looks like for you. You don't have to believe me. You don't have to take my word for it. You can tell me to go fuck myself. I'm cool with it. Okay. I'm more than used to that. All right. But I do this because I give a shit. It's not because I'm trying to scare people. It's not because I try to, it's not even a one-up at this point. Okay. So the next time you want to have faith in some sort of democratic notion, a congressman or congresswoman or AOC or anybody else, making laws, calling shots, even the medical field coming out and saying this, that, and the other thing. Just remember, the indoctrination system is filtering through everything. They all want us dead. They're just been told that they are doing some sort of service for humanity that's not actually playing out in the real world. because when those institutions and systems rubber meets the road, people are severely harmed, if not dead, because of it. And it's needless. It's needless. And we're paying for it. We pay them to do this to us. And that's the part that just, oh my God, it's soul crushing. It really is. And I'll sit there and burn with you over that. But there are a few good people trying to freaking get their shit together and go, oh my fucking God, what the hell is this bullshit? Right? And nobody saw it coming. We got, some of us were like, I can't. I know I can't. I feel it in my gut. I know I can't do this. I don't want to hurt anybody, but I'm gonna have severe problems if I do this. As someone who had severe reactions to flu shots, like, I recovered every time, but like, I was out, like, on the couch, couldn't move, was like, get away from me. I don't know what the hell this is, but you don't want it. And I was like, every time I freaking get a flu shot, this happens. Like, I'm going to pass this year. I'm just going to pass. I'm going to take a hard pass. And lo and behold, I didn't get the flu. It was crazy. It was just, I was like, well, and it could be because I have a whole fucking arsenal of immune system stuff that I do just when fall hits. It's just what happens. It's just how you get through life. It's like, well, season is upon us. Time to buffer it up. I don't know why the doctors can't do that for some reason. They're like, just get your flu shot and eat your shit and go about your business. No, you buffer. You buffer. You know the immune attack season is coming. Buffer. It is just it's a practice. It's a practice and it's a way of life. And it's not better or worse than anything, but pretty effective. Pretty fucking effective. I mean, I kept several other people alive on the protocol. And it's just an immunity thing. It's an immunity. And you got to know the people you're dealing with, too. You've got to look at, I look at the birth chart, or I look at their tendencies, if they're hot or if they're dry, if they're more moist or whatever. And then you shift the immune boosters accordingly so they don't get miserable while they're taking the immune boosters. Okay? And again, this is doable for everybody. You don't have to have an herbal practitioner. You can take an Ayurvedic school. You can take evolutionary herbology. Out in California has a course that you can take. They have several courses you can take. They're fucking magically wonderful. But if you want to get into the astro herbology sector, that's definitely a choice. And these things are not licensed. So just your kin, yourself, your loved ones, your friends, family. Okay. We don't need huge overlords. We don't need droves of people being gurus and goddesses. We just need to allow people to exist in this modality and have a place to live in the community and be supported. Okay, I've seen this coming 10, maybe even 15 years ago. I saw this coming. And it's not that it was preventable, because the systems were designed to work how they were working. It wasn't that the systems were flawed. Those systems were designed and set up to work exactly how they're working. And that's a difficult thing to come to terms with, because I probably wasted too many years fighting tooth and nail for people that we're never going to see a change in the medical system. I saw a lot of people die under the medical system, and it was fucking horrific. But, like, oh my God. Okay? That is a hot pocket that we are not going to investigate, okay? So, comprehending that this is feasible for all human beings. It's just if it's your calling or not. Do you feel called to this? Do you resonate with it? Do you have compassion here? Do you have a passion for plants and people? Do you have a passion for planets or doshas or whatever the heck it is? However this fits for you, whatever modality you need to step into, this is the time. This is the calling. This is the place. This is, your witchy friend knows way the fuck more than you think she does. And I pinky fucking swear she is not doing fucking voodoo hoodoo stuff behind closed doors. That's a closed practice anyway. Most of us aren't. Some people aren't even aware it exists. It's a closed practice. You can't do it. And those people that are doing it, I'm gonna plead the fifth. I'm gonna fucking plead the fifth. Let those people do what they need to do. They know exactly what they need to do. And they're vibing it out. Let them. Let them. They know exactly what they're doing. And it's fucking gorgeous. I don't care what anybody says. Okay? So, I know nothing. I know nothing about it. It's again, a close thing. But you read energy. And you know what they're doing. Love you. I know I'm not allowed to, but I see you anyway, bitches. And thank you. Much appreciated. So, when we get into the body and we sense like, oh, maybe methylene blue isn't right for me. Maybe I need to go the other route. Investigate. Again, it's all about looking up, and now the eyeball is like, hey, how dare you cry in front of the people or on the camera or whatever the heck it is. Okay. When we get into our body and we start sensing things, okay, and I don't care how much you like me or don't like me or whatever it is, ask yourself first. Okay, let's do this. Rather than take anybody's advice, even a medical professional, okay, which please read the paperwork and all the fine print before you sign anything medical. They got a thing where, like, if you don't do what they want you to do, they're gonna send you over to the loony bin. Okay, I've known a couple people that have had that happen to them, where they're like, I don't really like what this side effect is gonna do. Can you give me something else to go with? And then, they're like, no, this is what you need to be doing. This is the only thing that works. And then they're like, is it true? And I'm like, well, they could try this, 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 and this. Okay, so be your own best advocate, please. Okay, look into stuff. Make sure you look stuff up before you start taking it, because sometimes the side effects risks are far worse than the actual condition itself, and there's other ways to work around it that don't involve being miserable for the rest of your life. Okay, so please be your own best advocate. Now, I'm not telling you to ignore them, because sometimes what they have to offer works. If you have a broken bone, just go, bye. I'll drive you. We're going. It's happening, right? We got to go to the hospital. They do good work. Okay. They have effective procedures for a lot of different things, okay? I'm not negating them entirely. I'm just saying that there's a lot of things wrong with it. And the way the system is designed and run, it's a parasite still. It's not a service to humanity. It's more of a parasite. Like, there's a lot of people out there that just refuse to go into the doctor because they know that if they do, they're going to find out that they have like something horrible wrong with them, that they're going to have to pay houses worth of debt and probably end up homeless anyway. So either way, see what I'm saying? See how inhumane the system is. Okay? So get into your body though, because sometimes their medicine works. You might have a system that particular medication is peachy keen for. We have to accept this about real life. Sometimes things just work and they're good for you, and you're supposed to be on them because you're benefiting from it and it's not causing any harm. Okay? So I'm not saying it's one size fits all and it's black and white. There are some instances where things do a lot of good. Okay. I'm not saying that at all. That the system doesn't do some function of good. But the problem is again, it's still parasiting on humanity, especially now with Medicare and Medicaid being and severely cut to the point where, like, yeah, it's going to get bad before it gets better. So we need to buckle up and be supportive of one another, please and thank you. Okay. So this whole spiritual narrative that money's just a frequency and health, blah, 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 blah. If you don't know, if you weren't instructed, if you have no fucking idea how things work and nobody's helping you through that, how the fuck are you supposed to be all healthy and prosperous when everything is in this fucking system is gatekept? I will forever be confused about that. Again, victim blaming, I'm not a fan of. Okay, personal responsibility, absolutely. That's how I got here. Okay, so holy tangent. Okay. So here's a few ways that you can tell if something's right for you or not. Get into your body. Do you feel comfortable? Is it relaxed? Take a couple deep breaths. How do you feel about it? Say the word, the medication label, or the herb out loud to yourself. Say it, Metholine blue. How does that feel in my body? What does my body respond with? And if you are not used to or accustomed to, or you don't have a energetic pattern yet set up for yourself to get comfortable in your body, again, no judging. I'm not judging. Develop it. Take a few seconds every day and put your hand over your heart and take a couple, 3 deep breaths. 3 deep breaths and say, hi, I'm here for you. I hear you. I acknowledge you. I honor you. If you need something, please let me know. Please let me know. And that's a great way to start that energetic relationship with you and your body. Okay. So for those of us who do have it established, we get a sensation. We'll get a feeling. Otherwise, we'll just get calm. Everything will relax. Everything goes quiet. You're like, okay, this is good. Okay. If you're feeling tension in your belly, if you're feeling tension in your chest, you're starting to get head pains or back tension, probably need to, do a little bit more homework, investigate for yourself, because it might not be right. Okay. And for those of you who are like, I have no fucking idea how to do that with my body. Maybe you're in chronic pain. Maybe you had, things replaced, or you just had surgery, or you don't feel good. So you're already, like, if you have the cold or the flu, getting uncomfortable in your body, not really the greatest freaking thing. Okay. So whatever. Mm-hmm. Okay. Lock them like a chain. Okay. Right? And then ask yes or no questions only. Not, it has to be yes or no, because when you pull them apart like this, the answer is no. But when you pull and it stays locked and you're pulling pretty hard, that's your body's way of saying yes. Okay? I used to walk people through that when I worked at a health food store. That was actually protocol. If people were like, which brand do you think is better? And I'm like, I mean, there were some significant differences in a few areas, but it wasn't in every area. So it's more like just a preference. And so I would have them. I would hold both their bottles and I would say, what does your body say about this one? And have them do the muscle test. And what does your body say about this one? And have them do the muscle test. Okay. So it's doable. It's easy peasy lemon squeezy. So rather than shame or judge yourself, again, no guilt, no shame, just learning, just being curious and saying, I can do this for myself. Okay. Self-empowerment is nothing more than just saying, I'm going to learn something new every single solitary day of my life. Okay? Or I'm going to learn 10 new things every day of my life. Whatever it is for you. Sometimes that drives people and sometimes it doesn't. whatever it is. Okay? So, even if you don't believe you're learning new things every day of your life, you're still learning new things. It's just not, out of a textbook. Okay? You're observing new things, you're learning new things, you're integrating new things. Everything's coming in. Okay. So hopefully you get into that at least safe in the body and can talk to yourself gently, calmly. Okay. Then those of you who are here because you're called to a similar path, and you're fucking hell, I don't have any money to invest in these classes. What have we been talking about this whole fucking time? Darling angel, you are the future. Okay? Because there's going to come a time where we're not going to need medication anymore. We're not going to need surgery or anything like that. We're just going to need these things right here. And a sovereign this thing right here. Darling. So for those of you going, for fuck's sakes, I can't pay for fucking courses like that. Good. Fucking good. That's the universe going, you don't need to. The universe is telling you, you have exactly what you need, exactly where you are. Loves you. Okay? So no, don't need to be rich to do this game. Okay. Nope, not a requirement, because the future is medical intuition. Ooh, that's right. I'm not licensed, so I can say what the fuck I want. Okay? So, see? I tried to get licensed. I did. I tried to get a big boo-boo in a nursing, and clinicals came around, and I'm like, if I take this job, I'm going to commit suicide within 6 months. So I bit the bullet on that one. Okay. And then got into a completely different, it still was caregiving, and I was kind of overseeing the diets and caring and, all this good stuff and keeping them healthy and yada, yada, yada. So that aspect of it I did use. And if they did get sick, I would definitely use what I knew to get them out of sickhood. But for the most part, it is, futuristically speaking, going to be, because when they're going to shut down medical stuff, and they will, it'll be only for the elite.